we are down here at the Beltone Hearing Center in West Edmonton, and full disclosure, I have to let you know at home, you might not be able to tell this ear right here, that's just for show. It doesn't really do a whole lot. I suffered several ear infections when I was a young child, and since then I've basically been working with this right guy here. However, we are going to explore the possibilities of what I might be able to do. Ira Spiegler joins us now. Thank you very much for setting this up. This is like the best way to work. It's like, not only do I get paid to do this, but I'm basically getting the problem solved.
That's right.
So let's talk about hearing loss in general, because I think there's the perception that it's really just an old person sort of condition, and that's a myth.
That's the furthest from the truth. Hearing loss can affect people of all ages, and there are all different types of hearing losses. You can have hearing loss based on age, and that's called presbycusis. You can have hearing loss because of noise exposure, work-related noise exposure, and there are also hearing losses that you get as a child. You know, you just develop them as a child. You're born with them.
And I guess my question to you is, I always kind of feel like I'm different from everyone just because of that it doesn't seem like something that's very prevalent. But can you give us a sense as to how many people might actually be suffering from some sort of hearing loss?
Well, 20% of the population at large has some sort of hearing loss. So that's quite large. When you take the population of Canada, you've got a ton of people that have hearing loss. And the vast majority of people really don't do anything about it. Hearing loss is the third most common physical ailment after heart disease and arthritis.
Wow.
And yet, when you go for your annual physical, a hearing test is never done. And so most people don't realize or have never been told they have a hearing problem. And it's a tough thing to recognize for most people, especially age-related, because most people think in terms of loudness. If you can hear something loud enough, then you have no problem hearing. And if you don't understand the next guy that's talking to you, it's because he mumbles. Okay? But in fact, it's that some of your hearing can be impaired while others can't. And we'll see that later on the audiogram. Okay?
All right. Well, let's dive into some of this stuff here and kind of maybe take a look at what's happening inside my head.
Right.
Full disclosure, it's been about 15 years since I've had any kind of test or analysis done on what's happening here in my eardrum. So what are we going to do right now?
Okay, well, we're going to use a video otoscope to take a look inside your ear canal and see if everything is as it should be. We want to make sure there's no wax. We want to make sure there are no lesions in your ear. We want to make sure that your eardrum looks normal. Okay. And so we're going to have Bettina, our audiologist, take a look in your ear, and I'm just going to set this thing up.
Okay, this doesn't look daunting at all or terrifying in the least, but all right. Full disclosure as well,
first.
It might be a bit of a mess in there.
Takes a little while to just there, a little bit deeper, and back it up a little bit.
Well, there you go. It looks like some sort of weird, like, planetary probe. This is like alien life on Mars or something. What are you seeing when you take a look at what I have going on?
Well, we're looking at the ear canal. We see a little bit of wax. If you can just get that a little bit more over to his eardrum. There it is, perfect shot. The wax, this little piece of wax that's getting all the light, is blocking your ear canal, the eardrum, so we can't see the mandible, which is the the bone, the small bone in your eardrum that's attached to the eardrum. Ordinarily, you would see it.
Interesting. Well, we're going to get a Q-tip to kind of take care of that, I think, for the next segment, because we want to make sure that we are doing this as thoroughly and completely as possible. And how's this ear look?
Well, that's full of wax. And with this one, you've got a blockage of wax in your ear, so we can't even see the eardrum. That needs to be professionally cleaned.
Okay, well, there you go. This is news to me, and for those of you at home who are eating right now, my sincerest apologies, and if you wouldn't mind passing those along, Jason, that would be great. We'll be back out here to the Beltone Hearing Center coming up in just a little